Thank you very much. A beautiful evening, some lovely company, some wonderful dance. What better way to start celebrating 40 years of achievement for an organisation? An organisation that, in the words of Yuval Harari, a historian, would say is a fiction of our imagination. So I'm not being insulting when I'm saying that the network is a fiction, because I'm also going to say that our universities are a fiction. In fact, our countries and our states, by this same definition, are a fiction of our imagination. A collective fiction of our collective imaginations. But you may say that that is a problem, isn't it, if there's nothing real about this organisation? Harari's not saying there's nothing real, it's just the nature of that reality is constructed by us. And that gives us opportunities, because whenever something is constructed by a collective human imagination, the limits of that organisation and the limits of what that organisation can do for society are only limited by the collective imaginations of the people in that organisation. I want to quote a poem to start with, and I'll come back to Harari to finish. The poem is by one of our Australian poets, and many of you in Australia will know it. For those from overseas, it'll give you a flavour of our country. It goes like this: I love a sunburnt country, a land of flowing plains, of ragged mountain ranges, of droughts and flooding rains. I love her far horizons, I love her jewelled sea, her beauty and her terror, the wide brown land for me. How can something be at the same time beautiful and terrible? Could it be that the same thing is beautiful for one person but terrifying for another? We know that in many areas of the world, your postcode predicts your prognosis. Your standard of living, your health, could be a beautiful thing for one person and a terror for another. And not based on what you have done, but based on where you were born, based on where you were raised. Is that fair? Is that just? Is it right that those same people whose postcode may well predict their prognosis also have an inadequate opportunity to participate in the economic development of their country? It's not just a health inequality that we're talking about, it's also an economic inequality that we are talking about. I know that this is not new to many of you, and I know that ideas on how to change it are not short in a meeting like this, in an organisation like this. But I sense that why we are here is not to learn about ideas, but to think more carefully and perhaps reflect on how do we turn those ideas into something that actually makes a difference. How do we actually move from the evidence to the action, to implementation? So I thought, as your first speaker, I would be somewhat provocative and give you some reflections on a number of the innovations I've had the privilege to be part of, the ideas I've had the opportunity to put into practice, and to reflect perhaps why that was so. What were the key learnings that I can draw from moving from an idea, and we have plenty of those, to something that actually happens, that actually is implemented, that actually makes a difference in people's lives. Jared was a medical student, and he was part of one of the programs that we set up at Flinders, which enabled students to have a year based in primary care rather than the standard hospital rotations. As part of that year, he was in the nurses' station of a small hospital and was told by one of the nursing staff, look, you can see any of the patients in the ward, just don't go into that particular room there. Why, he asked. Oh, that lady is dying, and it would be inappropriate for a medical student to interrupt what is a very precious and important time in that family's life for the sake of learning medicine. He went, okay, that's fine. And he put his head down and looked at the notes and was going about seeing some of the other patients. While he was sitting there, though, that lady's son came out of the room and said to the medical student, Mum wants you to come in to the room. He came into the room. All Mum wanted was for him to hold her hand. And he was privileged to be able to be there at the time that that lady died. And she wanted him, the medical student, to be there. We underestimate the opportunities and the capacity for our students to give while they are students. And therefore we underestimate the opportunities that we have potentially as curriculum developers to transform the lives of our students, because that was a transformational experience for that student. Why was he invited in? He was invited in because he had known that lady when the diagnosis was originally made. He was then there when the chemotherapy was trialled. He was there when the chemotherapy failed. He was there when the radiotherapy was started. He was there when the radiotherapy was stopped. He knew that lady better than the doctors knew that lady. He had a relationship. We underestimate the capacity for our students to develop those relationships. That's, to me, a transformative education experience. I think of Frank and Marjorie Drew, two doctors who had grown up in Melbourne, trained at the Royal Melbourne, and were practicing just out of Melbourne, and decided that part of their vocation was to move the whole way across the country to a small town called Roebourne, which is on the northern border of Western Australia. For those of you from outside of our country, that's probably 3,000 kilometres from where they had grown up and where they had worked. They went to work in a predominantly Aboriginal community to serve the people. What was it that caused those graduates to move when so many of their peers stayed in the comfort of Melbourne, stayed in the comfort of their specialties and their hospitals where they had trained? What was it that transformed those people? These are the questions that we ask as educators, are they not? Because they are the type of graduates that we are wanting to see come out of our programs. Graduates who are prepared to understand where the need is, who are prepared to equip themselves to meet those needs, and what's more, to be part of that solution. Not just part of counting the demise, but part of the solution. In rural and remote Australia, in every 100,000 people, there are 150 more each year who die from avoidable causes of death compared to people who live in the cities. Just let me say that again. Out of 100,000 people, about the size of Darwin, this city, small city. If you were in a major city, there would be 100 people who had an avoidable death. If you were in a remote area of 100,000, there are 250. That basically, there's about 150 people here. That means all of you would unnecessarily die in the next year out of 100,000 people. If you knew that was going to happen to you, would you just still be sitting here drinking, sipping away, applauding the dancing. This is nice. Let's talk about what investment I need to make, what's happening with my mortgage, my superannuation, etc. I don't think so. If that was actually you who were part of those 150, there would be a passion to do something about it. So there's a not in my backyard phenomenon that occurs in all of us, where we think, well, that's not going to happen to me. But it does. It happens to our families, and it happens to people that we love. So what is it that can take your ideas for how to make these changes, how to make these transformations, and turn them into something that actually does make a difference? It's great to be here on Larrakia land, and I honour and respect the people who have welcomed us here. I come from Ghana country, which is 3,000 kilometres south of here, and a mighty sight colder than it is at the moment. Although I must say, it's beautiful and cool here in Darwin for this time of year. It's lovely. I would like us to think of our organisations as people. As Harari says, they are legal fictions. They are people that we have invented for the purpose of having an institution. But not in the way we would potentially think of them, but how does an Indigenous person think of the whole person? And when I say I'm analysing it from this perspective, I'm analysing it from what I've learned from Indigenous people. I'm not pretending to analyse it as an Indigenous person. But from what I have learned from Indigenous people, there is a holism about the way they view people and the way they view our world. And that is that it's not just a biological phenomenon. It's not even just an emotional and biological phenomenon or a social and emotional and biological phenomenon, but it is a bio-psycho-socio-spiritual phenomenon. That understanding of who we are and where we are underpins a lot of what I've learnt from Aboriginal people. So if we're looking at educational transformation, how could we analyse our institutions, our organisations, under that bio-psycho-socio-spiritual understanding? Because we all know, did anyone see the big ocean liners that were here earlier today? Huge. Aren't our institutions a bit like that? If we want to try and turn them, they somehow feel as they're always going in just one direction, and to get them to turn is almost impossible. So how do we do it? I think there is something that we can really learn from that bio-psycho-socio-spiritual understanding. So the biological. What is it about the structure and the DNA, if you like, of our organisation that we need to understand in order to be able to make our innovation happen? The key question here is, what problem am I trying to solve? Not what idea do I have, but what problem for our organisation am I trying to solve? And the closer it gets to the survival, the biological survival of the organisation, the more likely you are to be able to initiate your innovation. So if I look at many of the innovations that have occurred in Australia in terms of creating rural campuses where rural communities can actually participate with a full medical program across Australia, have they occurred because of the generosity and goodwill of our institutions based in cities? No. They have occurred out of fear. Fear of survival. Fear of another university having a medical school in that place instead. Is that something that we need to wash our hands and say, we're not going to get involved in that sort of thing as educational innovators? Well, if you want your innovation to happen, sometimes you have to be prepared to look at what are the alternatives and make the alternatives play into your organisation. What is biological death to one part of your organisation may be different to another. So when we were looking at establishing a one-year program based in rural primary care instead of in the tertiary hospital, what was it that motivated the hospital to let us do this? Their problem, Their existential problem was that they had too many students and they were burning out teaching on the wards. So if I took a few of their students and sent them out to a rural place, they had an easier life. They could get on with their clinical care, they could get on with their research. So I had to listen to what the existential problem was from their perspective. Not from my perspective. My perspective was all about encouraging students to take up a rural career. Their perspective was easing the pressure on their ward teaching and their ward work. We have to understand those imperatives from the perspective of the institution and be prepared to play in the sandpit of the politic. Timing is absolutely crucial as well. What is important to the funders of educational programs? Most of our educational programs get funded by government one way or another. What is important to them? Their existential crisis is election. Their existential crisis is election. So their point of coming to see what we see as important is when it affects whether they are going to get elected or not. So, if there is competition in rural seats for the electoral spots, you are more likely to get funding. If rural communities are taken for granted because they never vote differently, then you are less likely to get funding, irrespective of the health outcome figures or all of those other figures. So as medical educators, we need to be engaged in that political process. This is not a cynical process. This is a real process. This is a real process. It's just not our usual perspective. So biological, it's about real, it's about reality. Psychological. What are the psychological drivers of our organisations? One of the things, if you ask a Vice-Chancellor, what is the thing that they fear? The thing they fear is a student revolt. Students have enormous power within our institutions. Therefore, if we have students behind us, students saying, we want to do this, we are prepared to take a risk with our education because we see the benefits in this, that will drive people above us to accept that this might be a change that's worthwhile having. But what might be in it apart from fear for an educational institution? What other values do they have in their psyche? Don't know about you, but two that are very common are research and status. Research, absolutely crucial. So let's cast our educational innovations as research projects. That's what I've done with a number of the pieces of work that I've done. They have been cast within the institution as a research project, as an experiment. Let's not be frightened of the experiment, but appeal to the psyche of our organisations. Status. For a small institution, they love internationalisation. They love relationships with larger organisations. That's what this organisation can provide in spades. Through collaborating with other organisations of equal or higher status, you can bring a lot of status to your institution, and then your idea suddenly gets legs because it's bringing the reputation of others along with it. It's not just your innovator's reputation, but it's now the innovators of multiple schools around the globe, bringing them to your school. So think about the psyche of the organisation, the social aspects of your organisation. The key drivers of our programs are the people we are looking to be accountable to. Who are we looking to be accountable to? The communities we serve. The work that we did in Australia, a number of you would have seen the work that has been done and the investment that the Commonwealth Government has made in rural clinical schools. Billions of dollars invested in enabling 25% of medical students to have 1 year of their curriculum based in rural and remote Australia. How did that come about? It came about firstly by creating some evidence of a very small pilot. a very small pilot. Being under the radar in terms of the social networks in an institution is important until you get your evidence. You have to avoid the institution's immune system, because otherwise it will spit you out very quickly. So we did our pilot with 8 students in the Riverland and proved, in actual fact, that they did very well. But that wouldn't have changed Australia. What changed Australia was that the community liked them. And the community said, why don't we get the Minister of Health here and tell him how good this is? So Michael Wooldridge, who was the Minister of Health at that time, visited the Riverland. And instead of the university saying, this is a really great idea, we think you should expand this and give the universities more money, which will just be seen as self-interest by the politicians, quite rightly, the local mayors, the local school teachers, the local journalists, the local community, the patients, came to the minister and said, this needs to be multiplied. Within a year, what was an investment of $180,000 a year was up to almost $200 million per year, as this was rolled out across the country. The community are our greatest advocates. In fact, they are really our only advocates that matter to those people who are looking to fund us. But don't be frightened also about understanding the sociology within an organisation. So there's the sociology without that can affect us, the sociology within. Who are the power brokers within your institution? And what do they value that your program can offer? Again, it may not be the reason you developed your initiative or your idea, but what can you offer to those who are in power that they can see a benefit as well? Because collaboration and sharing within an organisation is far more likely to bring change once you're looking at substantial change than trying to do it in opposition. Competition for dollars, we usually lose. Collaboration, we more often win. But there's that extra element that the Indigenous people ask us to understand, and that's the spiritual nature of organisations, or of we as human beings. For me, I've heard that often expressed in terms of country, and you heard tonight about a welcome to country. That's not an arbitrary thing. That's not an accidental use of language. That is a very intentional welcome to who we are, who we have been, and who we will be. That spiritual attachment to country is woven into the fabric of the Indigenous understanding of humanity and of the world. The country that our institutions are located in is also real and important. And as many of us are looking to try and move our institutions out of their campuses, their current country, into other areas of country, we need to do that with an understanding of what it means to leave your country and be respectful of that for those who have only known a campus life. And we also have to have ourselves, I believe, as the innovators, an attachment to that new place that we are asking the university to go. So for me, it was very important that the places that we looked at, our postgraduate innovation, our undergraduate, our selection processes, all of those things, were actually the country that I was working in, the country that I had skin in the game. So think about where you are looking for your innovation, and if you don't have that, find people that do, to take the leadership, because it will require that passion. It will require that this isn't just an educational innovation, this is actually about the life and death of our community. It'll require that level of investment to actually see through a lot of the blocks that will come your way. So there's the biological understanding, there's the psychological understanding of our institutions, the social understanding of our institutions, the spiritual understanding of our institutions. Let's go back to Frank and Marjorie Drew, who went from Melbourne to Roebourne. The war came, they were split up, they had a few kids. Marjorie never practiced medicine again after she left Roebourne. In fact, the family somewhat disintegrated. How many of our colleagues do we find burn out as innovators? What's a great idea somehow has real adverse effects within the family or the friendships of those people who are so committed to them. But Marjorie and Frank's legacy was longer than just the time they had spent in Roebourne. Their first grandchild, 25 years later, was me. And I now recognise that where I am in terms of working in rural medicine, in terms of having a passion for Indigenous people and communities and the underserved, is not an accident. And neither is it something that I have invented myself. It's part of my bio-psycho-socio-spiritual inheritance from those people who have gone before me. And that understanding has been a buttress to me when things have been difficult. It's been a resilience factor for me and for my family when we have paid the cost of saving the world. Recognising that this isn't just something that we are doing, but it is actually part of a heritage that started before us and will go further than us. Who are the people in your lives, not necessarily your blood, but who are the people in your lives that are part of your heritage? And who are the people that you are now investing into that will be 25 years later the people who make even greater contributions to the people that you are wanting to work with? So if we want, we can ignore our biology, we can ignore what we eat, we can ignore our psychology, we can ignore our mental health, we can ignore our sociology, we can ignore our friends and just become workaholics. We can ignore our spirituality. But we do those things as innovators and as innovative organisations at our peril. Back to Harari, who says the network and all our institutions are legal fictions of our imagination, our collective imagination. Could it be that if we embrace fully both at the institutional level and at our personal level the bio-psycho-socio-spiritual nature that we have been given, that we can reimagine our organisations, we can reimagine our initiatives together in such a way that perhaps even our imaginations can't contain the impact they may have on our world. Thank you.